I'm Randy Reed, Executive Director of the National Lighting Bureau, and I am here with Dr. Mariana Figueiro, Professor, Department of Population, Health, Science, and Policy at the Icahn School of Medicine at Mount Sinai, and Director of the Light and Health Research Center. Dr. Figueiro has a BS in Architecture and Urbanism at the Federal University in Brazil. She completed her master's and PhD at the Rensselaer Polytech Institute, where she started her career, ultimately rising to professor and leading their lighting research center before joining Mount Sinai in 2020. She's received many awards, and the breadth of her work as a scientist and as a materials person in looking at new ways to measure the effect of light in human health. Her work shows the importance of light on the health for people working on submarines, for students attending school, and for patients with Alzheimer's. She's a fellow of the IES, and we're happy to learn more about light and its importance for us and our families. Dr. Figueiro, welcome.
Thank you, Randy. It's a pleasure to be here.
Well, thank you. And this panel discussion is sponsored by our friends at Ledvance. Dr. Figueiro, tell us a little bit about your background and how you ended up leading the new LHRC at Mount Sinai.
Well, as you said it in the introduction, I'm actually an architect by training, and then I got into lighting, as I think everybody else in the lighting industry, by accident. You know, we had a standing joke at the lab that your high school council will not tell you you have to go to lighting. Nobody heard that in their lives. And yet, once you get into lighting, you get hooked up and you just become a lighting person. So I got into lighting again by accident. I thought I was going to be a lighting designer, and I ended up being a lighting researcher, and then started working in the area of sleep and circadian rhythms. And, you know, that really led us to work in the health area. I've always been interested in applying light to make people's lives better. And that's where my career started. It's been a long run, but yet very short in that we grew. We ended up increasing the amount of work in the health-related area. And that was an obvious next step for us, which was to move to a School of Medicine, which is the Icahn School of Medicine at Mount Sinai.
Okay, and you did start there in 2020?
We started there in 2020, believe it or not, in the middle of a pandemic. Yes, it's been a little bit over a year now.
And then your researchers are still in upstate New York, is that right?
That is correct. It was actually it was a beautiful, I think, combination. So Mount Sinai did agree to move the entire lab, but they also agreed to rent a space in upstate. So that avoided relocation of the people that have been upstate for years. Everybody's rooted upstate. Nobody wanted to do the physical relocation, but everybody was extremely supportive and excited to move payrolls, let's put it that way, to Mount Sinai. So we are starting a new lab. It's a completion. It's been for the past 3 months. We've heard that we're going to be moving in, but it sounds like Valentine's Day is the final day. Let's hope for that. But we are already sort of using the space, not very officially, but we're still collecting data and using the space as much as we can.
How do you define light and health?
Well, let me start with the definition, I think, of health, which is really the absence of diseases. But I think in my view, and that is my architecture background coming into play, it really is making a difference in people's lives. So it's allowing people to stay home longer. It's minimizing risks for falls. It's improving sleep at night. It's making intersections safer for pedestrians. It's reducing pathogens in plants. It's increasing disinfection in spaces by using UV. So to me, all of this is light and health, and it really is what the center is about, or what this new center is about. It's really a breadth of things. Obviously, the clinical, the human, the sleep and circadian rhythms is a big part of it, but it's not the only part of work that we've been doing. So I think it's anything that we can do where we apply light to improve people's lives. I think that would be sort of the broad definition And you'll be surprised of how broad it is and how well received it's been in a medical community and in a hospital setting.
Well, you mentioned circadian rhythm, and one thing I've never quite understood is that our bodies are wired for 24.2 hours per day, yet we only have 24 hours per day. What is that all about?
Well, it really, I think, underscores the importance of lighting, because it is true, if we are in a dark cave for weeks, on average, we're going to have a 24.2 hours. But what's most interesting is that some people are actually going to have a little bit less than 24 hours, and some people are going to have longer than 24.2 hours. So there's a huge, but it's a short range, but there's variability within that range. So what lighting does, and what specifically morning lighting does, it resets your biological clock daily. So if you have 24.2, 24.3, 23.9, whatever it is, it brings us all back to 24 hours and all synchronized to your watch, which is what we want. We want to be able that your alarm clock is saying it's 8 o'clock in the morning and your body clock is saying, oh yeah, it's 8 o'clock, not 7:30. So you'll be able to have your social activities in tune with what your biological clock is telling you.
Okay, interesting. Can you give us another example of some of the work that you have done with light and research that is helping society or helping people?
Yeah, I think that there's an untapped opportunity for lighting, and we're hearing a lot about health equity. And one of the things that
what does that mean, health equity?
What it means is everybody of any race, any socioeconomic status has the same right to have access to health and healthcare. Okay. And one of the things about Mount Sinai is that they're very keen on that. They do want to make sure that whatever health treatment that they're giving to people, they're giving equally to anybody that needs the health treatment. Okay. So that goes into the research, that goes into the delivery of treatment. Obviously, we're very interested in the research side, and we actually recently got involved in a very interesting project that Mount Sinai started. Obviously, with COVID-19, there has been a lot of issues with respiratory issues. And one of the ways, especially during the pandemic, which was ICUs and emergency rooms, everything was crazy. So one of the ways that people, the physicians, would make a decision to whether they would send a patient home or they would keep the patient admitted to the hospital was looking at the pulse oximeter. So that would be, the blood oxygen, and what would be your blood oxygen. Anything below 90, you have to be admitted to the hospital.
This is the thing they put on your finger, right?
That's right. That measures your blood oxygen. Nowadays, we have the Apple Watch that does that. But, in the hospitals, what we have is those finger things, which they have, obviously, the commercial ones that you can buy in drugstores, and you have the ones that you find in hospitals, which is they're a little bit more sophisticated. But there has been a publication at JAMA not too long ago showing that there's a bias in the readings of these pulse oximeters. And the bias is that people who have a darker skin, the readings tend to be higher than they actually are. So in other words, if you have darker skin, the pulse ox is going to say your blood oxygen is 94%, and it may be 89 or 90%. So you may be in the cusp, in the border there, and if you have that bias reading, you may be sending people of color home when they should have been admitted to the hospital. So Mount Sinai was concerned about that, and they wanted to come up with a guideline to tell everybody in the hospital what to do in cases like that. So they invited us to be part of this task force, and we actually found out that the reason why we have this bias is because of lighting. It's because what happens with pulse ox, they used to be halogen that had filters. And with the filters, you have the ability to really have it a very narrow bandwidth or very narrow peak. Now with LEDs, that peak is not as narrow. So what happens is it introduced that bias with the interaction with the skin. So we're now working with developing a solution for that. And it's been very exciting because it's the ability to show that you can use physics of light, our understanding of light, to help the medical community.
That is a fascinating study, and I can't wait to learn more. How would you characterize the sensitivity of physicians and medical staff to lighting in support of light and health?
Well, I have to say that it's an ongoing change. I think when I first got there, they were like, "What? Lighting? What do you mean light and health? Light and Health Research Center?" But one of the things is that the folks at Mount Sinai are amazing in terms of the collaboration. These are nice people, open to collaborations, and they all really opened their ears to us. So they were very interested in what we were doing. And they didn't dismiss it as being something not scientific or not real, or quite the contrary. They wanted to learn more. So the past year, I've been doing it almost every month, a grand round, what they call it a grand rounds, which is really talks that you give to different departments within Mount Sinai. And everybody's extremely interested. So I would say that the acceptance, it's growing. And I think that our presence there, it's actually elevating lighting to a very different level, because people now are taking it seriously. They see lighting as something that should be considered. And, I hope that this will bring even more I don't know. I wanted people to think of lighting more. And I think that we're going to get there. It's a work in progress, but I think we're going in the right direction.
Well, speaking of a work in progress, what would you like to see happen to lighting, say, in the next 25 years?
Well, first of all, I would love to see it being understood by many more people than just the lighting folks. I think the whole idea is to get people outside lighting to talk about lighting, or to discuss lighting, or even to prescribe lighting in a way, to use lighting as a non-pharmacological intervention, or an intervention that can—
Say it again. A what? A
non-pharmacological intervention, which
what does that mean?
That means that you're not giving people a drug. You're treating people with something that it's not a drug. Now, it's not going to be the only treatment, but it could be something that would go as an adjunct, as a combination with any other drugs. So, for example, we're about to start a study with cancer patients, and we're going to do the lighting inside the hospital at Mount Sinai. And it's myeloma transplant patients where we're giving the light to help and train their circadian rhythms and help them sleep better. And with sleeping better, you have better immune functions. And with people with myeloma transplant, having better immune functions is all they need to recover faster. So that's what I want. Ultimately, I want to change the entire lighting in all the hospitals, in all the nursing homes, in all the residences, so that it's just like ergonomic chairs. We all have them. So I want lighting to be that kind of thing.
Well, I've spent a lot of time personally in a nursing home with my mom the last couple of years, and the lighting is horrendous. That's all.
It shouldn't be. It shouldn't be, Randy.
Just horrendous.
Yeah.
So I wish you luck with that. Okay, so you are our first speaker in this series, Let's Talk About Light and Health, which is a collaborative between the National Lighting Bureau and the Light and Health Research Center. What do you hope to accomplish through this series?
Well, first of all, Randy, I do want to thank you for joining us and collaborating with us in this series. I think it's a very important series, because what it's trying to do is trying to listen and talk to the users of lighting. It in a way we tend to talk to ourselves too much and not listen to the people that are actually using and benefiting from lighting. So the idea here is to show that there are users, there are people that are interested, there are people that can benefit. So it's try to expose the lighting people to the people outside lighting and vice versa. I think the more we can integrate lighting with all these different fields, I think the more we can see lighting being implemented and being used and being normal, and talked about and thought about. Everybody takes lighting for granted, and hopefully this series will help people stop doing that. That's what I hope for.
Well, Dr. Figueiro, this has been great. We thank you for your time today. We thank the Light and Health Research Center, and we would like to thank our sponsor, Leadvance.
Well, thank you so much, Randy. Like he mentioned, and like Mariana mentioned, the series is going to be really nice, I think, to get some good feedback from everyone. Like he said, we have a lot of attendees coming. It seems like from a lot of different backgrounds, whether it's in lighting, more clinical side, or even some people in academics. And I know I invited some people that are more just on the user side of lighting. So we'd love to hear from you. Like Randy said, please put your questions in the Q&A. So it looks like I have a couple here. So I will start reading those. So I have first one from Greg Barker. So Randy, if you don't mind unmuting Greg, and if you could say your question out loud for us, and we'll answer it.
Yes, thank you. The speaker mentioned improving lighting in hospitals, and I'm curious if your team has developed recommendations for 24/7 facilities such as hospitals and correctional facilities where the staff on the nocturnal shifts have very different needs from the residents.
Yes, thank you for your question. Yes, we have. We actually have been actively working. We just finished off a project with NIOSH where we were working at lighting for day shift and night shift workers in healthcare facilities. And as a coincidence, as we speak today, we've been talking to some people that are involved in correctional facilities as well. So we do have that information. You can easily reach out to me and I can share with you the information we have so far. But in a nutshell, it really is looking at ways to increase light during the day so you can increase alertness in the day shift staff. And then at night, we're trying to maintain alertness without disrupting the biological clock. So we've been working with things like implementing red light, and we are actually being very successful at that.
Thank you, Greg. Looks next that we have a question from Matthew M about 40 hertz light. So it's an interesting topic. So Matthew, would you like to ask your question?
Hi, this is Matthew from Electra Lighting. I am under the impression that the exposure of 40 hertz light or audio can help stimulate certain region of our brain, therefore being used to treat in Alzheimer's or other brain disease. Just curious whether LHRC has research like this, and whether there's any finding on the amount of dosage or exposure needed to have effective effect on treating.
Yes, we have. We actually just received a grant from the NIH to continue the work. We had some pilot study we had done that we were able to show that you can increase 40 hertz gamma power by delivering a flickering light at 40 hertz. So for those of you who are not familiar with this research, what that is actually research that started at MIT. They have done a lot of work with animal models, and what they showed is giving them 40 hertz flicker entrains the gamma waves in the brain to that frequency. It could be through flicker light, and some people are using sound, and the people at MIT are actually combining the light and the sound. In the animal models, they did see beneficial effect on reducing plaque accumulation, which is the hallmark of Alzheimer's disease. And they are now doing clinical trials. And what we are doing is slightly different. It is, yes, we are doing the 40 hertz, but we're combining that with the tailored lighting intervention that we have successfully used to entrain circadian rhythms in Alzheimer's disease patients. So our hypothesis and what we hope to accomplish is improve sleep by giving them this tailored lighting intervention, which then would help improve cognition, and then increase that gamma entrainment by giving them the 40 hertz light, which we hope to also help with cognition. So we're sort of doing similar things, but slightly different because we're using also the work that we have done in the past. And we hope that the two treatments combined will actually lead to a better result than either treatment alone. The only results I have is a paper that we published showing that you can increase gamma waves by giving it a flicker light, but this was in healthy adults. And we're currently collecting data in mild cognitive impairment subjects as well as in healthy controls.
Thank you.
Great, thanks. So we have another question from Chelsea Thomas. Chelsea, if you could let us know where you're from. It sounds like you are with a company who's using light in spaces and trying to use daylight. And please let us know more about what you're doing.
Yeah, sure. This is Chelsea. I'm from Ford Motor Company. We're just trying to figure out for some of our newer spaces what the best approach is for, natural light and how it impacts the occupants. So we've just been seeing a lot of research that says, maybe occupants just like change throughout the day. So we've even seen some that says like just, dimming or raising or lowering the light, impacts them. So we're just kind of like trying to approach the spaces on the interior now, like, okay, we want to get as much natural daylight for the exterior spaces, or I'm sorry, the spaces that have windows, can bring a lot of natural light in, but the spaces more in the core of the building, we're trying to figure out the best approach. Like, do we just put those products in that, change throughout the day, but they like physically look like a window with that fakey window look, or is it important to still, actually have a spectrum change throughout the day where we've got those newer products that actually don't even change visible color, but they're changing the spectrum. So it's just trying to get some understanding of the research around that.
Yes, so I know that there's a lot being said about tunable light and changing spectrum and changing, mimicking daylight. I can tell you that for circadian rhythms, for how it impacts your circadian system, as far as we know from the research, a photon is a photon, whether it comes from daylight or from electric lighting, it's a photon. Obviously, daylighting is a very effective light source for the circadian system because it's extremely bright. It's obviously free, and it has the right color. It's on at the right time, so it's a perfect light source. But unfortunately, not all of us have that in the built environment. In terms of needing to use the changeable light, I have not seen any data showing that you need the tunable or the changing in spectrum. You do need bright. You need bright days and dark nights. So just increasing light levels should be enough. Now, you can increase that circadian stimulus, which is how you're affecting your biological clock, in different ways. One of them is just changing the amount of light and maintaining the spectrum, or you can vary the spectrum and vary a little bit less the amount of light, but you still need to vary the amount of light. So what I tell people is if you don't have the budget, you don't really have to go with the tunable or the change in spectrum to achieve what you need to achieve in terms of the circadian. Now, there is a side of that, which is really the human perception and the acceptance and whether people like it or not. And I think that we don't have enough studies out there showing that people prefer the change in lighting just because it's less boring, for example. So I think that there's still some work that needs to be done on the preference part, but if you're only concerned about the physiological impact, you can do it with brighter space during the day, dimmer at night. And that should be enough for what you want to accomplish.
Mariana, could you go a little bit more into the stuff that we've done with blue light? Because I know, we mentioned the brightness of light, but we can also impact circadian stimulus that you mentioned using specific colors of light. Can you go more into that?
Yeah, sure. I mean, we're very sensitive to short wavelength light, right? So the peak sensitivity of the circadian system is around 460 nanometers, which is, by the way, shorter than the melanopsin alone, which clearly suggests that it's a combination of photoreceptors, it's not just melanopsin. But the bottom line is you put blue light in the space, it's very effective. To give you a ballpark, you need about 30 lux at the eye of a 470 nanometers, while you're probably going to need 300 lux at the eye of a white light source. So one of the things that we have working with, and Allison has been leading that with Charlie and others, is how do you do layers of light? Because you really don't want to get everything out of the ceiling. So one way to do that is to use either desk lamps that deliver that 470 nanometers, or even if you want to have ambient light, you can do wall washers delivering and mixing with the ambient light this sort of narrow band colored light. And going back to the first question, what we've been doing is using that saturated color light, blue during the day, and then moving on to red at night if it's a 24-hour facility, because now you can give that alerting stimulus without affecting the circadian system at night. Like Allison said, I think be creative. We always say think outside the ceiling, because it doesn't necessarily have to be everything coming from the ceiling. And maybe think of outside just white light sources, because you may be getting a lot more just by adding a task lamp delivering, monochromatic or narrowband light sources.
And that brought me to a question that I had for a lot of our attendees that are here. They may not necessarily be people in lighting. They may not know what you're saying when you mean 470 nanometers. So what is something that attendees or anybody in their lives can be doing to be getting this type of lighting intervention that you mentioned, kind of these bright days, dark nights? What can we be doing in our daily lives to bring back to the topic of today, your daily light? What can people be doing in their own lives to be getting this light stimulus?
Well, best thing is go for a walk in the morning. I recommend an hour if you can. Sit by a window and face the window. Do not sit against the window, because you're really minimizing that light exposure. Open up your shades, let the daylight in. And you do have in the market a lot of these red, green, blue, or RGB light sources that you can have an app and then tune it to what you want. And in fact, Allison has a YouTube video that it's great, that does show you how to build these light sources. And, if you get one of these lights, and you will see what the 470 is, it's really blue. It looks blue to the eye. It's just saturated blue color. But I think that, start with, if you can't go out, start with adding some desk lamps and table lamps or floor lamps near where you spend most of your time during the day.
And how about, we have, manufacturers for lighting, for controls on this call as well. Is there a way that we can start a conversation between these different types of people in different backgrounds to be starting these conversations with these end users? If anybody has any input with that, definitely raise your hand and contribute to this conversation. We want to hear from you for all of these too. What do you feel about going forward in lighting and providing all of the lights for people and starting this conversation with better circadian stimulus for better sleep and better health for people? So if you have any input on any end, any perspective, we'd love to hear from you.
Yeah, and I do have to say that when we say think outside the ceiling, that's a very important point, because manufacturers tend to just think about ceiling lights. And if we're going to start talking to people outside lighting, and we want people outside lighting to use lighting, we got to make it easy for them. Okay, we got to make sure that they have access to that lighting. They're able to buy them. So think of ways that the distributions channel would include the end user and people that can more easily buy and plug in and install these kinds of lights in their homes. I think this is the most important thing once we start getting out of lighting, which is really what we want. We want to reach more than just the lighting industry. And for that, we need to make it easier for them.
Looks like we have a chat here. If the space has normal everyday lighting, but we have a desk lamp with 470 nanometer light, would that cause short circuiting of the effects, or would that still work?
Now, I think the question is if you have your ambient light on and you add the 470. Now, what your circadian clock is doing is really summing up all the light that you're receiving. Yeah, we have, which I'm not going to go into detail, but we have some sub-additive response, but that 470 nanometers at around 30 lux at the eye is so effective that it will definitely be, you will have a positive net, let me put it this way, because your biological clock is really summing up everything you get, doing the sums in the eye and then sending it back to the brain, and it should be effective.
We have another question as well. As you develop circadian effective lighting, what are the schedule parameters that you consider?
I'm not sure I understand what scheduled parameters are. What you're saying is during the day and at night. I mean, honestly, you can get fancy and do, 2-3 hours. Because of energy efficiency, you may have to do that. So if you're going to increase light levels, you want to increase in the first 2 to 3 hours in the morning, and then you can start dropping a little bit. I don't recommend dropping too much because light also has an acute direct effect on people, and you need to have it at higher light levels during the day to see that acute direct effect. So I wouldn't drop it a lot more over the course of the day. And then, starting a couple of hours prior to bedtimes or to desired bedtimes, you do want to minimize that light. So you want to dim it down, reduce it, and make it a little bit less or a lot less circadian effective about a couple of hours prior to your normal bedtime.
Okay, and George Bosson has raised his hand. So George.
Hi there, everyone. I'm George Bosson. I'm with a company called Light Glass. We produce virtual windows and skylights for purposes of circadian entrainment. We've been talking with end users. Some of the end users that we've been talking with are big box stores that have, that have break rooms that have no windows in the break rooms. So here you have people working very hard all day long, and they go into a break room that's like being in a prison cell. And we found that the owners of these companies are very happy with the results that their employees are feeding back to them about the change in the break room with these virtual windows that we produce.
Okay, well, thank you for that. I have seen some of those virtual windows at Light Fair from a couple of companies. Dr. Figueiro, do you have a comment on that, on those virtual windows?
No, I know George, and I know the product. I have not yet worked with them. And again, it's back to my point. I mean, this is delivering both. It is delivering your circadian effective light, which is very important. And it's delivering in a way that believes that it's coming from windows. So I think that that's part of the perception and the preference that I think we need to collect more data and do more studies on those. Because, it's not about circadian lighting only, okay? There's a lot more in the design of an environment than just giving high CS. If you're going to give high circadian stimulus, like I said, 470 nanometers, 30 lux of blue light at the eye, you're done. You don't have to change anything else in the space. So you know, I think it is about preference, it's about what people like. So you can combine making the space more pleasant and at the same time delivering the correct circadian stimulus. So I think that that is really the key. And I think that there's a lot of research that still needs to be done to show that. Not that we don't know that it works. We know that the circadian stimulus work. We've done a lot in the field. I think more of the perceptual and preference combined, I think it's important to do more work on that. But I'm not surprised that the acceptance is high.
We do have a couple more questions, a little bit more about UV and IR. So I'll kind of wrap a few of those into one. But some people are wondering if UV or IR have, sorry, that stands for ultraviolet or infrared. It's kind of past the visible wavelengths on either side. Do those have an importance for the circadian clock or circadian rhythms?
You know, when you get to the UV part, you know, below 380 nanometers or so, you do filter all that radiation through your lenses. So it's not really effective because it doesn't reach the back of the eye. And to have a circadian effective light, you have to reach the back of the eye. You have to pass through the lenses, the cornea, and get to the retina and be perceived by the photoreceptors. So I don't see any application. Obviously, the application is for disinfection. We're doing a lot of work with plants and reducing pathogens in plants. We're doing work with room disinfection, air disinfection. So all of this, obviously, it's a different application. You have UVB on the skin, which is important for vitamin D. So all of these are health related, but not necessarily for circadian effective. Same thing with a long, very, very long wavelength. So we don't see that being as effective for the circadian system, but that doesn't mean it doesn't have other health effects. There's a lot of work being done looking at wound healing, for example, in longer wavelengths. So I think that there are health benefits, but not necessarily circadian effective benefits there.
And we do have some other talks later this year that do go over more on UV disinfection and how it impacts plant pathogens as well. So definitely join us for those as they pop up later this year.
That's correct. We have that, and we're also going to have one on the health equity part that I mentioned in the video. I think that's going to be also very interesting. So we are going to be touching more. I mean, this is just the first one to give an overview of what the series are going to be. And I myself, I'm going to be talking about more specific on lighting for older adults in a few months too. So Dr. White will be here in February talking about lighting for NICUs, newborn intensive care units. So it will be a pleasure to listen to him.
Derek Miller, if you would like to unmute yourself, it looks like you have a nice question. So if you could explain that, that'd be great.
Yeah, sometimes when I describe circadian stimulus and what it can do to melatonin content to friends and family, the first reaction is often negative in that they assume people will be using it to keep people awake against their best interests. So my question is, do we expect any kind of regulatory efforts or should there be any regulations or standards around lighting spaces, maybe without the occupant's knowledge, that might be manipulating their melatonin content?
Well, if we're talking about daytime, we don't have melatonin production during the day. So what you're really trying to do is, if you think of it, you're trying to mimic what natural conditions are, which are they're normally bright during the day and dark at night. I don't see why that would be a problem. Now, people can bicker about metrics and about this and that, but we do know that right now the built environment is too dim to activate the circadian system. And that's particularly true for Alzheimer's patients, prisoners, people that cannot go out and get daylight. Okay, we have the luxury that we can go out for lunch or we can go out for a cup of coffee and we can get that light. But in spaces where we don't have that luxury, I do think we should be regulating or at least telling people that the light, teaching people that it's better to provide more robust light dark patterns than what we have been doing. And that includes increase the amount during the day and reduce the amount in the evening. So it's really a bright and dark.
Well, Dr. Figueiro, I want to thank you for being first, for being our guinea pig. Very nice job today. Allison, we want to thank you. And we also want to thank our audience. We were very pleased to have this many people, many of which are outside of the lighting industry. Please stay tuned for our next series, which will be 28 February, Out of the Womb, Lighting Up the NICU with Dr. Robert White. And we'll be publishing that information on the LHRC website as well as the NLB website. Thank you all.